I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. So Reggie and Naomi, thank you for joining us on Here for Good. Reggie, I'll start with you. So tell me about your journey at Virtua. How long have you been at Virtua and where you work?
I started out on the phones doing primary care scheduling. Then right before COVID hit, they asked me to help out with call coaching and joining the training and development team, and then was offered a full-time position as a trainer.
Tell me about the training and the process. Are there certain characteristics or certain traits that you look for?
One of the first things we look for is compassion and empathy. Because of what we do, dealing with patients and some of the things that they have to deal with, I believe you have to have those traits first.
Naomi, I have to ask, did he train you?
No, he did not train me. I wish he did.
You wish he did. So what about your journey? So how long have you been at Virtua?
Coming up on 5 years.
Really?
2 weeks, yeah.
And what about that journey? How did you arrive here?
I went through the, I guess the recruiting agency that the Access Center goes through, Emerson, but I had no idea that when she was giving me the information for, oh, there's this opening at an Access Center. It's right over in Pennsauken.
Didn't tell you it was Virtua.
Didn't tell me it was Virtua.
Maybe that's a good thing.
Had no idea that I came home the night and he's like, that's where I work.
So working in the Access Center, obviously, what's your current role? What do you actually do?
I am an Access Center navigator, but I work with the Virtua Care line, which is our high touch group. Mainly deal with like marketing leads, people who see our commercials on TV and everything, and Facebook, emails. The number that is listed there, it comes over to our group, and we get appointments, any interests that they have, any questions, things like that.
Give me an example of perhaps a call that you've had as a result of somebody seeing one of our commercials or ads, and how does
that? All of those calls coming in, oh, I want to schedule a mammogram, but a lot of people don't have prescriptions. So in that case, we kind of push the mobile van, which is really awesome. So you don't need a prescription as long as you haven't had your mammogram within a year.
So is that what you would define as, you say, high touch? Explain that a little more for me.
Kind of more like specialized calls with those marketing leads and marketing campaigns. There's one project that we're doing right now, which is the oncology project with our Penn Hematology Oncology and RCCA, where we get all of those patients coming in from nurse navigators to, kind of handle their cancer care.
Tell me about the team that you work with. So I've had a chance to visit the center on a number of occasions. And the one thing that I noticed was it seems like everybody was fairly close, kind of supporting each other. Was that just for me, or is that the way it always is?
No, our group is so special. And, when people are like, when you work at a job, they're like, oh, we're like a family. Mm-hmm. Sometimes that's like, are you really like a family?
More propaganda than anything. Yeah.
But no, the Access Center as a whole is truly like a family.
So Reggie, back to you. Did you always know that this was the type of role you wanted to be in?
Not at all. And it's funny you say that, because I've coached youth football and things like that in the past, and you're dealing with kids. But as far as training and development, this wasn't something that I seen myself doing. But again, our leaders have a knack for recognizing certain traits in people. They seen that I was a good call coach and I was good at helping people. And again, they were like, well, why don't you try out the training and development part? I said, no problem. And it went from there to, hey, you're going to do the next training class.
It's like surprise.
Yeah, like surprise, right? So I said, okay. I've never done this. I've never been one to stand up in front of people, teach people how to do certain things, and it was natural.
So do you still coach? I know you said you coach youth sports and things like that.
No, I gave it up.
You gave it up. So
coaching adults is enough. right?
Totally different. Totally different. Yes, it is.
So, Naomi, you mentioned that working in the Access Center is like a family. Tell me about your real family. I mean, you're sitting here with your father, and I'm sure there are some unique dynamics that create. Tell me about your family.
You got to start from the top. I deliver you.
Oh, yeah, he did deliver.
Oh, say, how do you need that out?
Yeah.
So rewind a little bit. I'm gonna ask the question again.
Okay.
So, Naomi, tell me about your family.
This guy delivered me.
And how did that come about?
So I was born in Lawnside, New Jersey, small little town, and it was a cold winter night. I guess my mom was just chilling at home. She's like, "Oh, something's happening." This guy springs into action. 5 minutes later, I'm here.
Had you prepared for that, or you just?
It was just one of them things. She thought she was going to the bathroom, and I said, no, that's Naomi coming. Lay it back down, and 5 minutes later, like she said, here she is.
Quick and easy.
So, yep.
Quick and easy. Have you been quick and easy since then? No.
I tried to be.
I recognize that the work that you both do is very challenging. I mean, you get people sometimes it's their first entree into our health system, and sometimes they're at their worst. And so it requires someone that can demonstrate, as you said earlier, compassion and sort of talk to them, get them at ease, and let them know that we're a high-touch organization. And so thank you both for everything that you do for the community, for our patients. And I'm glad we got to tell your story. You guys should have started with the delivery, and it would have made the rest of the conversation go equally as smooth. But thank you so much for joining us.
Thank you for having me.
So another edition of All in the Family. Thanks for tuning in, and we look forward to telling more wonderful stories on Here for Good, the Inside Edition.